a prosthodontist. I'm a specialized dentist. We specialize in full mouth reconstruction for prosthetics. Most of you are very young in this crowd. Most of my patients are 60 and 80 and above. But every now and then, we do see some patients that suffer from missing teeth. But first, we'll watch this video. This 85-year-old woman is skydiving. And just watch what will happen now. She's the cutest 85-year-old woman you've ever seen. I love it how she tries to grab the denture with her teeth while it's flying out, while she's 4,000 feet up in the air. But can you imagine the embarrassment that these patients have to deal with? Most of us have teeth in this room. Imagine you didn't have teeth. You can't smile, you can't speak, you can't talk, you're always embarrassed, you're always worried about your grandchildren seeing your teeth pop out by mistake. But what could it always be? I mean, edentulism is a state of not having teeth. It could be partial, it could be complete. But what drives someone to lose all their teeth? It doesn't make sense. When I was in the United States, when I first saw someone not having teeth when I was a student, I was shocked. I said, what is this? I've never seen this before. But it's actually quite prominent. In the state of West Virginia, when I did my training, 50% of the population were edentulous. That's absurd. 50%. These people need to live. They come from a different generation. The causes are actually many. Some people are born without teeth. It's called anodontia. Some people are missing teeth because of socioeconomic problems, financial problems, genetic problems, gum disease. Some patients actually are more prevalent to gum disease. I've seen certain ethnicities and, how can I say, races more prone to periodontal disease. We've seen that a lot. Trauma, accidents, bad oral habits, cigarette smoking, drugs. All of these can lead to you losing all of your teeth. It's actually quite prominent, more than you think. We are a center located in Dubai Healthcare City that deal with these type of patients. Most of our patients are from this population. But the struggle of humanity with trying to replace teeth actually goes back to 4,000 years, maybe even the ancient civilization, such as the ancient Egyptians. There is evidence of archaeologists finding ivory teeth embedded inside archaeologically found skulls. Humans have been trying to implant teeth back in the jaw for thousands of years. Even with early implantology, in 1914, Dr. Goldstein took these basket implants made out of 18-karat gold, and he put them into the extraction sockets. But gold and palladium and silver, nothing seemed to be working at the time. We struggled for hundreds of years trying to find a cure for edentulism. With modern implantology, most of that has changed. And I'll explain that, who has done that. In fact, all of these contributions are made by a man by the name of Professor P.I. Brennemark, who was in Gothenburg in 1953. He was concentrating on something completely irrelevant. They were looking to study blood vessels and formations of blood and angiogenesis, and the doctor here understands. And what they were doing is that they were putting titanium chambers, which are screws, inside the rabbit tibia of rabbits. And they were just trying to study blood vessels, and they were looking down with a microscope, and you can see here, they were looking down through the bone and trying to see formation of blood vessels. When his residents tried to remove these chambers from these dead rabbits, the chambers wouldn't come out. It was astonishing. They go up to the professor and say, "Professor, we can't remove these chambers." So he goes himself, sections the bone, and actually sees that the bone is going over the implant. It was a discovery by accident. For thousands of years, we couldn't know what material it was, and lo and behold, it was titanium. Titanium is the implant that is being implanted in people's jaw today. It's actually the material of choice. That's Dr. Brennemark with one of his residents. Under the electron microscope, when you look down into an osseograin implant, you would actually see an osteocyte, which is a blood cell, growing over these titanium rods. It was quite astonishing. In 1953, 1954, there was a quite remarkable discovery. But just like with everything new in the world, he was faced with hostility. Nobody accepted his inventions. In fact, people said he's a crazy surgeon. And one of his residents actually told me, Dr. Ulf Lakum, he's an older gentleman, retired now. He's like, when I first met Dr. Brennemark, everybody told me, don't work with this guy, he's crazy. But in fact, actually, he was ahead of his time. He was thinking 50, 60 years ahead of everybody else. And the Swedish conservative dentist, because he was not a dentist, actually ousted him. And nobody cared about what he was doing. And nobody funded his research. He was so desperate that he took dogs for 15 years. He was removing teeth on dogs and putting implants in dogs. And this is a black and white picture, but that picture on the lower left is actually gold. And he was putting gold teeth into these dogs. These dogs were having bling bling. And for 15 years, he showed solid clinical evidence that this was working in dogs. But still, the scientific community was not convinced. He actually was so desperate that they sacrificed the dog, tied a chain around an implant, and suspended the dog upside down. I'm sorry if anybody can't watch this, but this was happening in 1953. If you do this today, you know, it's a problem. In 1965, a man by the name of Gösta Larsen came up to PI and said, PI, I've heard of what you've been doing. I know it's never been done on a human before. Treat me like how you treat your dog. Put some implants in me, and this guy had been suffering from edentulism for years. He has no teeth, he had nothing. And PI was delighted. Of course, the first human to receive the osseointegrated implants, he can actually finally show the world that this is working. And that's exactly what he did. And Gösta Larsen passed away in 2006 after 40 years of these implants. Of course, he had some complications because they were the first implants. We didn't know how to make the screws, and we had some problems. But we learned some very, very specific lessons from this man. He changed our lives, and he changed the lives of our patients. In 1982, Professor George Zarb, who I've actually met in Ohio, found out about Brennemark, flew to Gothenburg, took a sabbatical, spent 2 years out there, and told Brennemark, if you could write about this, if I could get the North American to accept this, the whole world will accept you. And in 1982, in the conference of Toronto, that's exactly what they did. They wrote this beautiful classical article. When I was a resident in university, this is the first paper that they put in front of us for us to read. I read it 6 times, and I still don't understand it. That's how great it is. And in the bottom it says, I hope that my clinical research in Sweden will eventually someday spread out to the world. And that's exactly what happened. This paper was written in the early 80s. Soon, the scientific community was static. Everybody was happy. Oh my God, look at this invention. For 4,000 years, we've been struggling with this, and this Swedish orthopedic surgeon was able to solve this problem. Everybody rushed towards Brennemark. The first osseointegrated implant in the United States was placed in Bethesda, Maryland. And every surgeon in the world, everyone that can afford to fly to Sweden, went to Brennemark and begged Brennemark so he can teach him put implants in. What has changed? Well, this is what actually applies to you all, because you all have grandparents. You all have elderly in your home that you may want to take this message to them. When Professor Brennemark initially invented dental implants, he said you put the screw in, and then you wait about 6 months, and then you put the teeth on. Well, that's exactly what was happening. But today, that has changed. Some guy came and said, well, if you enhance the surface and you make it really rough and you laser blast it and put it in acid and shoot aluminum particles at it and make it really rough. Somebody came and said, well, if you change the screw and play with the thread, and the research, just enormous amount of research started coming out after the 80s. And some other dude came and said, well, if you change the surgical protocol and do this and do that, and that's exactly what we did. From A to Z, now we can do teeth in 1 day. It's a newer thing. Patients always ask me, how come you can do it in a day? Well, because we know we've done our homework. We know what we're doing. In fact, we're so confident in doing it that we actually advertise that we can give patients with no teeth in 6 hours. We're doing it every week, day in, day out. In Dubai, we're doing it. People in Saudi Arabia, Kuwait, Alain, everybody is coming towards us, and we're doing this for them. This girl was 20 years old. Hala came from Saudi Arabia. She was suffering from anodontia, a genetic disorder that's congenital. It genetically causes people not to have teeth. She said, I want to get married. And it was very important for her to have teeth at her wedding night. We gave her teeth in one day. These are 12 prosthetic screws, what Dr. Brennemark used to call fixtures. On top of that, imagine your balcony suspended from your apartment. It's a framework. On top of that framework, you have porcelain and ceramic. And that's where she is today, and she's extremely happy. We've done her about a couple years ago. She comes and sees us every chance she gets. And she's now in dental school studying to become a dentist. It's very important for her to be able to do that now. Diabetes type 1, local Emirati girl, 28 years old. Dental neglect and diabetes type 1 has caused her to lose most of her teeth. This was one of the most difficult surgeries we've ever done, but one of the most dearest cases to me, because this girl, she's such an angel. We were able to give her teeth in just 2 appointments. Quite remarkable. All because of Dr. P.I. All of this is because of Brennemark. Palestinian woman with 2 kids, a banker, doesn't have time to go to 50 dentists, doesn't have time to go to someone who doesn't know what they're doing. She wants to come in and out. We finished her in just simply 2 appointments. She's one of our biggest advocates. She sends us patients all the time, even the ones that just to come for a simple checkup. A edentulous patient, a Saudi ship owner, extremely wealthy guy. Comes in, he says, I want teeth right now. We didn't even know who he was. He just walked through the door. In the United States, we spent hours filling out forms and asking about his grandmother and his grandfather. We don't do that anymore. Osseous-integrated implants are real. They're right now, they're today. Quick medical history check. If he's healthy, we go to town. Professor, a physics professor, so busy reading physics books and calculating solutions to difficult problems, forgot to brush his teeth. We were able to construct teeth for him in just 2 appointments. He was embarrassed in front of his colleagues, in front of his students, and he said, before September starts and my classes start, I want to be able to talk again and look no. Yes. And we gave him teeth. This is a 2-year post-op. Look at the health of the tissue where everything else was inflamed before. I was aware to take an impression when I removed the mold. I was saying, God, please don't make these teeth come out in my mold when I first saw. But now that's not the case. He's so comfortable, speaks, eats healthy, and he's such a great man. He visits us once a month. Now, I could only fit this many in this photo. We have hundreds of these cases. These patients are eating again, sleeping again, comfortable, not worried about waking up in the morning finding their denture drooling on the side of their mouth, not worried about their grandchildren seeing them with no teeth, not worried about skydiving and the denture popping out of their mouth. These people are comfortable. They bring us gifts when they can. We're so happy to see them. This is right here in Dubai. We feel very privileged to be here in this city and be able to do all this. But none of this would have been possible without the work of this man. Dr. Brennemark passed away in December. Excuse me. But the lessons he taught us is remarkable. That's Dr. George Zarb. I met him last year in Ohio State, and we drank too much wine. He told me some crazy stories about when he was in Sweden, and what a remarkable character. All these guys, you can just sit down with them, and it's like watching going through the history books. That's Dr. Costa and Dr. Petros, the founders of our clinic and Orflacom. And thank you for your undivided attention. And if you have any questions and you need to ask me about your grandparents or your grandmothers or your grandfathers, please come to me.